7:20. It's Monday morning, and over the last few weeks we've had to bring you at times some really distressing and sort of tragic news over the last few months really, but we're also doing our best to bring you some of those stories of those people who have recovered from coronavirus.
They include Angela Schlegel, who says COVID-19 actually saved her life. While being treated for the virus, doctors discovered she had a rare undiagnosed heart condition. We'll talk to her in a moment. First though, let's look at the moment she got out of hospital.
And delighted to say that Angela joins us now from West London. Oh, you're right.
Really lost it.
Alongside one of the consultants who treated her, Dr. Poojan Patel. Thank you very much to both of you for being with us. Angela, lovely to see you dancing in the car there, but you seem to be doing a bit of dancing this morning as well as we're coming to you. But tell us a little bit about your story, because it's a remarkable one.
I'm still getting my head around it, really. Good morning, everybody. So I went into hospital with really bad COVID symptoms, and on the 22nd of March I went to Chelsea and Westminster A&E, and then a few days later I was in intensive care, and then I was transferred over to Royal Brompton and under their care, and they told me some news that I really wasn't expecting, that I had a rare autoimmune disease and that it had really badly affected my heart.
And before that, you knew nothing about this heart problem at all, is that right?
No, I had 2 years of getting on with life but feeling unwell at times, going back and forward to the doctor with asthma, really bad asthma symptoms, and kept picking up colds, and was treated for chest infections, but still living a very active life. But I had no idea that my heart was in a bit of trouble.
And Dr. Poojan Patel, so how dangerous is this autoimmune thing that she has?
I guess if I could just briefly say how nice it is to see Angela out of the hospital and doing so well, actually. After seeing her for 4 weeks in the hospital, it's fantastic to see her doing so well. But going to your question of how severe it is, it really is quite a severe condition, especially when the heart is involved, and that was the case in Angela. And I hope she doesn't mind me saying, but her heart wasn't particularly functioning very well at all when she first presented.
I was reading through the case details. I haven't got the case notes, but some of the details of the case. And is it right that her heart was only functioning at about 10% of its capacity? Is that right?
Yes, exactly. I mean, we should really have a functional level around 50–60%, but she was down, near the 10 mark, essentially, when she first came into us.
Which sounds incredibly serious, and so was that up straight away. And then when somebody has got a situation like that, how do you then have to tailor the sort of coronavirus treatment at the same time?
Yeah, well, I mean, it's a very good question. The real challenge to Angela's case was the superimposed COVID factor, because we know from evidence that's come around from across the globe that COVID can involve the heart. So you've got a scenario where you've got a possible component of COVID stressing the heart, and then you've got this underlying rare condition that's also taxing Angela's heart. And it was really, luck and good fortune that she was able to get transferred across to a specialist centre that really had the expertise and the breadth of doctors who are used to seeing this on a far more regular basis to then tackle the condition. Because to treat this condition, we usually suppress the inflammation with medicines that also suppress your immune system. So you can imagine the discussions that were being had between ourselves and all the consultants that were involved as to whether we suppress the inflammation in the immune system and risk worsening her COVID, or just finding a happy medium somewhere, because this is such a young disease and condition that we really don't understand COVID very well at all. So it was certainly a challenge, but she was fortunately surrounded by a team of very good doctors.
Well, what it shows is how brilliantly you all do your job. Angela, so you were in hospital for some time with 2 really serious conditions.
Nearly 5.
Gosh, how did you get through it?
Well, I did a post when I was in Chelsea and Westminster on Facebook, and it was a bit serious, that post, and everybody was worried, of course. And then after that, I thought, how do I make the most out of this time in hospital? And I didn't want to share what a hard time I was having. So I decided to share some positive posts and hope, and I knew people outside in lockdown were having a hard time as well, and I wanted to show them that hospital can also be a good place to be. I don't know how. I had, you know, like everybody else, a really hard time in hospital, but I also had an extraordinary time, so I wanted to share some of that with my friends.
And Dr. Poojan Patel, I know you. You know, dealing with coronavirus patients all the time, and there are some terrible outcomes for not only the patients but their families as well. And I just wondered how important and how sort of encouraging was it for you as well and for the other staff to see the way that Angela reacted to not only having coronavirus but also this limiting heart problem?
Yeah, I mean, well, it makes a huge impact when we see patients who actually walk out of the hospital, because you can imagine the amount of suffering and loss of life that our staff, our nurses, our therapists, and everyone in the hospital has to see and endure on a daily basis. But when you do see that patient, you know, get up and walk out on their own 2 feet, smiling, it makes a tremendous impact to morale and just reinforces the work that you've done and makes it so much more worthwhile.
Angela, you're obviously out of hospital, came home. I think are you with your parents? Were you nervous about coming home?
I was nervous about coming home. That's why I dressed up in a full suit when I left hospital, so that I wouldn't carry all of the germs from the contaminated ward home with me. I had 2 showers that day, which was very tiring, just to be clean for when I got home. And then I self-isolated for a week, just to be extra precautious.
And how do you feel now?
Oh, I'm still recovering, but I feel so great to be at home and to have got through all of that. Yeah, it was quite an experience. I want to thank Dr. Poojan for his positivity. When he first came into, I was in an isolated room then, I thought, oh my gosh, he's so upbeat. And that really made a difference. And he continued to be, and he reassured me, and all of the doctors did there. The nurses and all of the staff at Brompton, really what they are doing right now and across the UK, their compassion, their care, their professionalism in such a hostile environment, and it's not normal for them to go to work in that way, and so I'm so grateful. Thank you very much.
Oh, that's a wonderful message. It's lovely to see your positivity clearly rubbing off on each other. And Dr. Poojan, just to come back to you, I'm sure I saw you smiling there while Angela was talking, but are things getting any easier, do you feel, in the sort of care for COVID-19 at the moment?
Yes, I can certainly say that, you know, the pressure is easing, and we're certainly able to cope better. That's all in the context of having to, you know, triple the capacity that you're used to dealing with, and so we're not quite back down to our normal kind of functional levels in terms of the normal beds and numbers that we have. But we're certainly being able to cope better. Our nurses, our therapists, the entire team is finding it far better, easier to manage now that we've gone over the worst initial peak.
Well, thank you for the work that you're doing, not only with Angela, with so many patients that you and your team are seeing. And Angela, lovely to have you on the programme today. Good to see you doing well.
Yeah. Can I just say, everybody, it's not just affecting our senior population. There were others on the ward that were a few years younger, that were a few years older than me. So just be mindful when we ease lockdown, and look after each other, continue to do that. And it's such an unpredictable virus that we don't know the long-term effects. So I just don't want anybody else or their families to go through what I did. So please stay safe.
Thank you, Angela.
I'm absolutely transfixed by the pair of you. Thank you very much indeed. It was really good to chat. Thank you.
Oh, I love it when positivity rubs off on someone else, and then
she's just a little ray of sunshine.
It's just great, yeah. I feel lifted by Angela and Dr. Poojan.
There's other sunshine on the way, isn't there, Matt?
Good morning.